My name is Kiera, and I'm here with Danielle and Tilly. We're going to be performing our intervention with a face wash. I'm going to play the client, Heather, and Danielle and Tilly is going to play the student OT. And they're going to demonstrate it here, or walk you through it.
Okay, so we're going to start this intervention with errorless teaching, and then later on in the session, we're going to be moving into cognitive strategy training. And the purpose of that is to go through errorless, make sure our client doesn't make any mistakes, make sure we're trying to relearn previously learned tasks, because our patient does have RLA-5, her movements with ideational apraxia are not generally going to be very purposeful, so we want to make sure she doesn't make any mistakes as we go through a task that she's known very well in the past. And then by moving into cognitive strategy training, we're hoping that we will, with a little bit of less help with the errorless teaching, a little less prompting, we'll start to see more purposeful movement from our client. All right, Heather. So to start with, we're going to grab our bag. Perfect. And turn on our monitor. Good job. Bring your wet. Check and see if it's too hot. Good job. Turn on. And squeeze. Good. Great. Another great thing about this task with somebody with RLA-5 is that it also provides us some sensory input too that will help them orient a little bit more to their environment.
Now we're going to complete a cognitive strategy approach to assist with Heather's ability to complete her face washing and simple grooming tasks. The focus of this treatment approach is to improve Heather's cognitive skills such as memory and sequencing. We will continue to use errorless teaching as needed. With cognitive strategy training, we hope to see initiation of steps and more purposeful movement. All right, Heather, so we're going to wash your face. So what is the first thing that you need to do when washing your face? No? Turn on the water. There we go. Good. Now what do you need when you wash your face? Washcloth. Okay, so we put that in your hand. And now, what do you have to do after you get the washcloth? Put it under the water. That's right. Good. And now you're going to do what? Good. Bring it out. Good. Now, let's turn off the water. Okay? So now what do we have to do so we can wash your face? Put the washcloth up. There you go. Make it both sides. Good. All right. Good job, Heather. So now we're switching roles, and I'm going to play the husband, Mr. Johnson, and then Kiera and Tilly will play the occupational therapy students, and we're going to provide the education that we would give during our following our treatment session.
Hello, Mr. Johnson. I would like to discuss with you about your wife's session, as well as provide some education in regards to Heather's self-care tasks. During treatment, we have worked with your wife with grooming, such as face washing, and with her brain injury level, with a Rancho's Los Amigos level 5, she has challenges with knowing what to do when completing the task, even simple ones. She will require help with completing simple tasks because she can't remember the steps, even when we just taught her the steps. Today, during the treatment session, we will help her. We have helped her complete every step of face washing. Then the next time we have completed the face washing activity, activity or task again, we gave a little bit of help with face washing. We started to see her move her hands in the right direction towards the faucet and then towards her face, but she still needed assistance following through each step.
Okay, so when can I expect for her to be back to normal?
I know that this is super frustrating sometimes, especially when you're the one helping to take care of your wife. So as we sort of started to explain, the Rancho Los Amigos level 5 generally means that her memory is kind of non-existent, kind of even when she's relearning tasks. Like she used to know how to wash her face. She doesn't really know how to wash her face anymore. So her memory is pretty it's a little tough, but that sequencing too, remembering all those steps is really difficult. She's got a lot of cognitive challenges right now. So as we see her kind of level up and get better, we're hoping to see her memory improve. She'll start to like initiate those steps a little more. So when we were in the bathroom washing her face, we kind of started to see her move her hand toward the faucet a little bit, but then she needed help to kind of complete that step all the way of turning the faucet. So as she gets better, we hope to see that she's able to do that step all by herself, and then eventually remember that the next step is to grab a wash rag and get it wet and then touch her face. So there's lots of levels, and it'll take a lot of time, but practice is really the most important thing for her right now, as well as making sure that we don't overwhelm her with too much activity. We want to give her brain some time to heal and give her time to relearn these tasks and kind of guide her as her memory improves and as her cognitive skills improve. Does that make sense?
That does make sense. I thank you for explaining it to me. I mean,